So everybody knows spring is here and kids are back on the fields playing sports. And that makes for a great time to learn more about orthopedic practice in the local area. Joining us today is Dr. David Bika from University Orthopedics, who specializes in the treatment of spine and sports medicine related injuries. Good morning, doctor. Good to have you here.
Thanks for having us.
Look, we all probably know about University Orthopedics and with the great care, but what exactly is it that you specialize in?
Yeah. So first, just go over what University Orthopedics is. It's our largest orthopedic practice in Rhode Island. We have specialties for orthopedic oncology, even pediatric surgery. Ortho Direct is essentially an acute care for musculoskeletal injuries. We have facilities in East Providence and in East Greenwich. We really want to cater to the injured athlete and the acutely injured individual. That's where we're sort of making this program for.
Right.
Yeah.
I was talking to you just a couple of minutes ago, just saying that now that they are back, have you seen an increase in injuries like this? Because kids are, we've seen the kids play. They're rougher than when I was a kid. I'm not getting out on the field.
Yeah, no, they are. There is a higher level of injury, which is part of the reason why we want to sort of foster that communication with the parents, that we are open for the acutely injured athlete. Sometimes they just need reassurance, right?
Right.
Sometimes they need something more. Our services at Ortho Direct have, on-site X-ray, on-site musculoskeletal ultrasound. We do casting and splinting. And then, one of the best parts is we coordinate with our pediatric orthopedic surgeons, just in case your son or child needs to go to Hasbro. We coordinate with that service.
Right. Well, how do you know? Look, I had two daughters who played soccer all the time, and everybody was getting injured all the time. When do you know? Okay, you need to go someplace and get this checked out.
Yeah, so there are several criteria that we use. Say for example, a lower extremity injury, ability to weight bear 2 hours afterwards. If they're still limping, yeah, you should come and see us.
Right.
Or a guarded arm like elbow or shoulder. After a few hours from the injury, if they're not moving that joint, come and see us. I think that's a perfectly way of doing that.
What's the benefits of going to see you folks at Ortho Direct instead of maybe a traditional emergency room that somebody
so
may
we
go
partner
to?
with Lifespan. We're a close partner, so we work with them. But what's the benefit from rather than the ER? 8-hour wait time, right?
Got it.
That's what you get when you go to ER.
Right.
Our wait times are far shorter. If you call ahead, we can actually book you on an appointment. It's just a rapid ease of care. For an urgent care, we're primarily only musculoskeletal orthopedic care, so we specialize in that. So we are a little better than our traditional urgent care.
Sure.
But we use emergency rooms all the time when the level of injury deems it.
And talk about the facilities themselves. We've been there before, and they are beyond state-of-the-art facilities here.
Yeah, they're great. So, we have a place in East Providence that's our sort of mothership.
Kind of right over our shoulder.
Yeah, it's, 4 stories. It's a phenomenal facility. Our first level is where Ortho Direct is. We have a surgery center. Physical therapy is on the 4th floor. And we coordinate that. So when you come in for acutely injured body part, we're going to start the initial treatment. Sort of rapid treatment often leads to a more rapid return to sport. So.
Now, concussions are one of the things we hear about all the time as kids get back out on the field, no matter really what sport that they're playing. Talk to us about that and the treatment that you folks have there, too.
So, in the Ortho Direct, if you have an acutely concussed individual, we can evaluate that. We have a team there with Dr. Salco and myself who do concussion management,
right.
And we have Caroline, who's a physical therapist who directly does physical therapy just for concussions. And there's a lot of really good research on vestibular rehab for rapid return for cognitive symptoms. And then there's also really good exercise as medicine to sort of have that child slowly progress to their level underneath their symptom management, underneath how bad their symptoms are.
And this isn't just for younger kids. This is for, if I was to get out on the field and hurt myself, I could go to see you too. Not that I'm going to do that.
Yeah, absolutely. We don't have any age restrictions, right? I think we'd see all ages. Younger than 2 years old, that's a little bit different. I think
Sure.
that's younger than 2 is probably the age bracket that we don't see.
Got it. Thanks for coming in.
No
good
problem.
to see you. And if you are looking to make an appointment at University Orthopedics, whether it's for you or for the little one, you can head to our website. That is roadshow.com.